Hey everyone, welcome back. So going to do a slightly different series of videos, not entirely massage related. Obviously, having been a nurse and a midwife, I do find that my clients ask me a range of slightly more unusual questions. It's going to be down that line that I'm going to go with this video today. So I'm going to be talking about the colour of your urine and what that actually tells you about your health. So, colour of normal urine, it can range from a pale yellow to a deep amber colour, depending on your hydration levels and therefore how diluted or how concentrated the urine is. It also varies according to a pigment in the urine called urochrome. Sometimes, depending on your diet, certain foods may also alter the pigmentation in your urine. Things like beets, some berries, fava beans are well known for colouring your urine. Also, many medications can also change the colour, giving usually more vivid tones of yellow, greenish blue, maybe even red. So that's also something to consider if you're noticing changes in the colour of your urine. But the more unusual colours can sometimes indicate some sort of disease, such as porphyria, which is a red blood cell disorder resulting in a deep red to brown urine. The concentration of your urine will depend, as we've said, on hydration levels, how much you drink, and of course other factors come into hydration levels, for example such as climate, how much you sweat, because obviously if you're sweating you're excreting urea from the kidneys through your sweat, and therefore there's sort of less coming out through the body as urine. The more you drink, obviously the clearer your urine will be, but if you drink less, then you're going to be more dehydrated, and so there's more chance that your urine colour is going to be darker, in severe cases even towards brown. Now, urine, unlike poo, which I'm also going to do a video on, can be all colours of the rainbow. It can be red, blue, green, yellow, dark brown, cloudy white, so there's quite a range there. Urine colours that are not due to food or medication may be due to a medical condition, and that is particularly the case if you have any of these following risk factors. So the first one is age. Now, obviously bladder and kidney tumours can cause blood in the urine, and these sort of things are more common in older people. Men over 50 may also have blood in the urine due to an enlarged prostate gland. So with advancing age, we must also consider the fact that there's a higher risk of certain types of medical conditions. Also, family history. Family history of, say, kidney disease, for example, or kidney stones. This will increase the chance of you developing these problems, and therefore, an increased chance that there may be a change in colour of the urine. Another risk factor is strenuous exercise. Now, this would be something particularly like long distance runners, for example, anyone who exercises vigorously. And again, rather like climate, if you're doing a lot of exercise, you're going to be sweating a lot more, and therefore you become more dehydrated if you don't, maintain your fluid intake, because you're losing water through sweat and you're excreting all those toxins from the kidneys through your sweat, and so then that changes, the fluid balance and the urine output. Now, one thing I must say, if your urine is bloody, you should always consult with your GP, especially if this is combined with pain or burning sensations on urinating. This could be a sign of urine infection, pyelonephritis, kidney stones, which obviously would need, something like pyelonephritis, it would need antibiotics. So it's always best to check it out. Now, if there's noticeable blood in the urine but no pain, then, you might think, oh, well, there's no pain, so it's not serious. You should still get it checked out, because again, this could actually be an indication of cancer. So we're going to look through the different colours of urine that you can get and what might cause these colours, so that you can sort of better identify whether there may be a problem. So now obviously we've talked about sort of the normal colour would be a pale yellow to amber. So we're going to talk about some of the more unusual colours. So red or pink urine. Now, red urine may not be serious. It may, as we've just sort of talked about, may be caused by blood. Now, this is known as hematuria, and it may be due to a urinary tract infection, maybe, kidney stones, maybe an enlarged prostate, or possibly cancerous or non-cancerous tumours. Even kidney cysts, kidney stones are also, common culprits for blood in the urine. And also long distance running, again, believe it or not, can cause blood in the urine. So obviously some of these conditions are more serious than others, but again, it's always a good idea just to get it checked out, get a urine test done with your nurse at your GP surgery. But red urine, it may not always be because there's blood in there. It could be due to your diet. Certain foods like beetroot, blackberries, rhubarb may well turn the urine pink or red, and that's entirely normal if you've been eating certain quantities of these foods, and really nothing to worry about. Also, certain medications can turn the urine red or pink. So something like rifampin, which is an antibiotic used to treat tuberculosis, pyridium, otherwise known as phenazopyridine. This is used to numb urinary tract discomfort, and also laxatives that contain senna may also be responsible for turning your urine more of a red colour. And again, if it's due to sort of medication, again, it's not generally anything to worry about. Now, maybe a slightly more unusual colour, or a colour that we may even think is a little normal, but just something to be a bit more aware of in terms of medical conditions, is orange urine. Now, again, medication may be responsible for this. Anti-inflammatory drugs such as sulfasalazine, again, the pyridium that we just mentioned there for urinary tract discomfort, and some laxatives again that contain senna may cause the urine to become orange. Also, for those cancer patients undergoing chemotherapy, some chemotherapy drugs can also turn the urine orange. Obviously dehydration, you know, we've mentioned if your hydration levels are not great, then, you know, if it's a particularly hot day or if you've been sweating a lot, again, you know, your urine is going to be more concentrated and may even, you know, go past the deep amber into more of an orange colour. So then you basically need to drink more. But in terms of medical conditions with orange urine, you want to be looking at the liver. There may be liver or bile duct issues that are causing the discoloration. And especially if you're finding that you've got orange urine combined with either pale poo or yellow, you know, jaundiced skin or in the whites of the eyes. This is often a clear indicator that there is some kind of liver problem. So definitely, you know, if that's the case, then you want to get that checked out. Now, the next colour we're going to talk about is blue or green urine. Now, sometimes certain dyes can cause green urine. Also, there are some dyes that are used for kidney and bladder function tests, which may turn the urine blue. And also for women, if you have maybe gone in and had something like the TVT or tension-free vaginal tape surgery, they actually sort of inject a dye called methylene blue, which may temporarily, following the surgery, turn your urine blue. Certain medications, again, things like amitriptyline, indomethacin and propofol may, you know, cause a blue-green colour to your urine. And of course, you know, the medical conditions may be behind this. So things like familial benign hypercalcemia. Sometimes this is known as blue diaper syndrome because infants who inherit the disorder may have blue urine. Green urine will sometimes occur also during urinary tract infections if it's caused by the Pseudomonas bacteria. And so that again is something that really needs to be treated with antibiotics. Now, the next colour we're going to talk about is dark brown urine. So, as we've mentioned, severe dehydration can really cause the urine to darken, you know, dramatically into a dark brown colour, and you see this quite a lot on hospital wards where people are catheterised and maybe they have, you know, gone into renal failure. You know, the urine will go a really dark brown colour. Foods, again, large amounts of fava beans, rhubarb or aloe can cause a dark brown urine. Medications, you're looking at things like anti-malarial drugs such as chloroquine and primaquine, the antibiotics metronidazole and nitrofurantoin, which is probably a less common one. Laxatives, again containing senna or cascara, and methocarbamol, which is a muscle relaxant. All of these medications may also cause dark brown urine. In terms of medical conditions, you're again looking at the liver and kidneys. Certainly liver and renal failure can cause, you know, the urine to become dark brown. Severe urinary tract infections, again, may turn the urine dark brown. And then finally, the last one is cloudy. Sometimes it may sort of seem more of a very pale but cloudy urine. And again, this is a classic sign of urine infections and possibly also kidney stones, and which will make the urine appear cloudy or murky. So again, it's always a good idea to pop a sample down to your GP and just get it tested so that you can get treated for any infection as soon as possible. So yeah, so that is really sort of all the colours of the urine. Just to recap, so that is really all about the colour of your urine, and to help you recognise when there may be a problem. But as always with any changes that are unusual for you, do always get them checked out with your GP. And there will be 2 other videos like this coming up. One which will look at the colour of your poo and what that may indicate, and also one that will look at the colour and also texture of your menstrual blood. Yes, these are things that I get asked. So do feel free to comment down below, or you can contact me through my Facebook or Instagram pages. I'm on there as the Medical Massage Lady, and if you have any questions I will come back to you. Or you can subscribe to my channel, and you'll be notified when more videos come out. There are lots of other videos already up there, so do take a look at those. But for now, that is all from me, so I'll see you next time.